doing to provide this daily update. Even when many of us are working from home, Mark thankfully has been doing that from home some of the time. And so I'll just report, and we usually give the update of cases. So, we have over 368,000 cases in the United States now, with nearly 10,000 reported deaths. Alabama is reporting on their public dashboard 2,105 confirmed cases with 56 deaths. In Mobile County, that dashboard is demonstrating that we have 176 confirmed cases, with 6 reportedly died from COVID illness. So again, we are seeing the number of cases rise as we are starting to see more and more transmission in our community. So that number is going to rise. You may have seen some of the prediction models that have been put online by some really smart people and some international agencies, and so the peak in Alabama is expected to be around April 18th, something of that nature. But again, that would just be sort of the highest point in the outbreak that we would have cases relying on health care and illnesses and deaths. If that is true and we peak in mid to late April, then we will just be to the top of our curve, and we'll still have the downslope of the curve, which will take many weeks and months for us to try to get back, hopefully, to more normal times. So hang in there. Thank you for what you're doing to adhere to the health recommendations, to stay at home, to not only go out for necessities, to protect yourself when you have to go out for groceries or medical visits, and it's going to take us all coming together as a community to get through this. I just wanted to mention that we have the Mobile County Health Department has been providing a daily update on the characteristics of the COVID positive cases in Mobile County for some time now, and we just heard from the state health department that they have begun to do something similar. So this report is now available online, so you can check alabamapublichealth.gov and see the breakdown of the characteristics of the COVID cases that are being reported statewide. So I wanted also to point out a couple of other things that we are hearing from our federal partners at CDC. So yesterday, CDC published the first report to look at COVID-19 illnesses in children, and this was reported in the Morbidity and Mortality Weekly Report that CDC has. It's a public document, so anyone can go and take a look at it. And it states that while some children with COVID-19 may have mild illness and may not show symptoms, they can still spread the disease to others. It's important that people of all ages follow recommendations from CDC and state and local public health authorities to help prevent the spread of COVID-19. So this is just another in a line of publications that we have seen recently that demonstrate that there is asymptomatic spread of COVID-19. Patients who are what we call pre-symptomatic, so they will develop symptoms, but they haven't quite developed them yet, that these people can potentially can spread virus, so they can be contagious even though they don't have symptoms of COVID like cough or shortness of breath or fever. So I want to make sure that that's clear. That's part of the reason that CDC made the recommendation that anyone who is moving about the community, that a community like ours that has community spread, wear a mask to protect yourself. That was not something that we were doing a few weeks ago, but based on the most recent data and science, that is now a recommendation. So, remember, stay tuned, because things change dramatically as we're learning more about this unprecedented and unknown previously to us coronavirus. Also, I want to say that we are now in the accelerated phase of the outbreak nationwide. There are 29 states that are reporting widespread community transmission. The number of COVID cases reporting to the U.S. is rising quickly. So early on, most of the cases that were reported were due to travel to other countries or other areas where transmission was widespread. But now, more and more cases are resulting from community spread where the source of exposure is unknown. So I just wanted to make that note, just to point to make sure everyone understands that we're probably, the days of us asking you, did you travel to another country or did you travel to another state, are behind us, and now we are not able to determine where you may have been exposed in the community in many cases. I think nationally there are some 300,000 cases where the exposure location or the person that maybe infected new patients is unknown, or we're still investigating. So also this week, actually not this week, it was on Friday, CDC started producing what they call the COVID View report. So you can just Google CDC COVID View, and that will be a weekly, very detailed report that summarizes and interprets key indicators from a number of surveillance systems having to do with influenza-like illness and COVID illness. So if you're trying to stay up on the latest, you can look for that weekly publication from the Centers for Disease Control. So let me set that aside. And I need to give a shout out to Trina in billing. She's been asking me every day to send her a shout out. So thanks, Trina, for what you're doing behind the scenes to keep our health department moving forward. I get lots of questions about reinfection, and I just spoke with a reporter today about, can a person who has COVID get it twice? We know that people who are infected with COVID will build antibodies, or their immune system will respond and build these biological materials that we call antibodies that can help protect from infection, or this is the way your body fights off the infection when you have the virus circulating in your body. So we know that people their immune system will respond and produce the molecules that are needed to provide some protection. What we don't know is how long that protection might last, if it will protect fully or partially, if it will protect against other common cold coronaviruses. So that's where the science is still outstanding. So I'm just not able to provide a definitive answer to that, but I just want to restate that we know if people who are infected are building defense antibodies to that infection. In some clinical trials, patients who have had COVID infection are volunteering to let scientists retrieve those precious antibodies from their system and see if they can be a treatment or a cure for people who are newly infected. And many times when we face new illnesses like this, it's often our healthcare workers that become infected and recover that we rely on to work on the front lines of new cases and in hospitals and those sorts of things, because they have a level of protection that the rest of us don't. So just keep that in mind with regard to, can you get it twice? We're still sort of waiting to see the science and the data around that. Right now, we think the answer is no, but we don't know to what extent you will be protected after your first infection with COVID-19. Now, I mentioned about healthcare workers. I'm on the phone, and many of our leaders at Mobile County Health Department are on the phone all day, every day, talking to hospitals and long-term care facilities and testing locations that are having a difficult time keeping their facilities staffed with the healthcare workforce that we need to keep people well and provide the level of care that they're accustomed to. So I just want to make a plea to all of the healthcare workers that are working throughout Mobile County. If you are healthy and well, please report to work. Follow the guidance of healthcare providers, but we need every able and healthy healthcare worker to be working and helping us support sickness and disease in our community during this unprecedented time in our history. So again, if you have underlying conditions and if you're in some of those high-risk groups, we can put you to work working in healthcare, but not with COVID patients. So again, please, if you have a job in the healthcare industry, please to work to the greatest extent that you can, because we need you out there working in the hospitals and working in our long-term care facilities and other healthcare facilities. So just a comment about that. So Mark, I'll take some of these questions and answers. Is that?
We'll go with this first one.
Okay, Mark has a question that maybe has come in on Facebook.
They're wondering about the number of Black Americans facing alarming rates of coronavirus infection in some states. Have you seen anything on that, race problems, issues with coronavirus?
Yeah, I don't know national. So the question was, there are some reports out that maybe indicate that African Americans and maybe some other races, Mark, are mostly African Americans are disproportionately affected by COVID infections. I've not seen that report, so I can't comment on that, but I will look into it. But in Mobile County, I've been publishing the statistics on the number of African Americans who have positive COVID disease and the number of Caucasians who have COVID disease, and it seems to loosely mirror our population. But I will look into that a little bit more closely and provide some information for a future Facebook Live update. Okay, Mark? Okay. So let's see. Here's a question that came from, it looks like, one of our news partners. Question is, I'm inquiring about what Mobile County Health can do to provide more geographical information about COVID-19 cases. We've been releasing information on the number of cases by zip code to the fullest extent allowable by the HIPAA privacy rule. We have been releasing zip code level data even when some of our other public health partners have not been releasing that. So we're able to release zip code data on, I think it's 5 zip codes, as soon as those zip codes have at least 5 cases. So there are 5 zip codes with greater than 20 population living there, and once those zip codes have at least 5 COVID patients, we're publishing that information. And then all of the other zip codes we have to group by the first 3 digits of the zip code, so 366 and 365. And I understand that there are some other states and organizations that may be providing more detailed information than that. At this time, we're just not able to do that. We're not seeing any geographic clustering, so I can look at individual street addresses for these folks. We're not seeing any unusual geographic clustering. It looks like most of our cases are coming from where we have the greatest population, and we see a low number of COVID patients in rural areas where the populations are lower. So here is a question, also it looks like from one of our local newspapers, that says, there's been a massive drop in Alabama's projected number of deaths, needed beds, and ventilators in the online projection model. This is put out by the IHME. If you want to Google that and look at it yourself, it's www.healthdata.org/COVID. So a couple of days ago, that agency that has done these projections, they made some tweaks to their model, and they took into account the social distancing and the health orders and the closing of non-essential businesses, the number of cases in Alabama, how many deaths we've seen in Alabama, and then what's known about the biology of the virus with regard to incubation periods, duration of illness, that sort of thing. And I also heard, this is an unconfirmed rumor, that they may have had a decimal point in the wrong place. And then our numbers looked much less grim than originally projected. And as I mentioned, I think I might have mentioned this, I wrote this down and was going to say it. So IHME projects that our peak use of hospital beds will be on the 18th of April, but that we will have 0 bed shortages, 0 ICU bed shortages, and enough ventilators to handle that peak. That's based on a projected, so this is all modeling. The more grim statistic from that model is that by August, an estimated number of deaths in Alabama will be greater than 900 people. And so we are really concerned about that. And again, it's just more recognition that we are still fairly early in the most difficult part of this outbreak, and that's why you need to follow the state health officer orders and your local ordinances to the letter and not violate those, so that we could try to slow down the community spread so that we don't overload our health care system. So that is the question about the modeling. Let's see. So let me skip this one. So we had a question again about zip code. How are zip codes reported when it comes to cases and clusters? The question was if we had, multiple patients at a nursing home or multiple patients at a detention center, would positive cases be counted by the zip code of the long-term care facility or the detention center? So it goes by the zip code of permanent residence. So if a long-term care facility is a person's permanent residence, then that case would be reported in that zip code. For detention centers, cases identified in people who are incarcerated, again, we would use the zip code of their permanent residence. So that would not be the zip code of the detention center. So hopefully that asks, some of these questions are really quite detailed. Someone's been thinking about these things a lot. More questions about the modeling, if we have enough physician and nurse coverage. Have we noticed any flattening of the curve? Again, this is not our model, but you can go to that website to look at the projections that have been modeled there. Let me say again, since so many people are interested in this model, it is pretty cool, I've got to say. It's healthdata.org/COVID to go look at the prediction modeling for the U.S., for Alabama, and actually any country in the world. So let's see. We had some questions submitted to us from, I'm not sure who, but I'll just go through them anyway.
Yeah, go ahead.
Okay, so let's say someone was asking about the fact that Mobile County has 6 deaths. This was yesterday, and that only 4 had been confirmed in Jefferson County. What do we think we have, a lot more deaths than other areas? Right now, our numbers of deaths are really just too small to know if Mobile County is an anomaly from our counties in other states, or comparing to jurisdictions in other locations. I think, this is a challenge when you have very small numbers. People tend to, stake their trust in them, and when they move slightly, then we have big fluctuations. So I just think right now the deaths in Alabama are looking very much like the same way that they are in other parts of the state and throughout the U.S., that they are older patients with underlying medical conditions. They become sick with symptoms that are typical of COVID-19 illness. They're hospitalized, and then they die in the hospital. So that is such a tragic and unfortunate situation, but we don't think that there is any reason to think that we will have a higher death rate or different characteristics in our folks that are not surviving COVID infection in Mobile County. Are you seeing any indication of confirmed cases due to people visiting the beaches last month? I don't have any. It's not that I'm aware of, is my answer to that question. I don't have any knowledge. Again, now that we have, wide, community transmission in Mobile County.
Well, once again, I appreciate you being here today, and we'll have 4 or 5 bullet points that I will talk about, and then I'll be ready to answer questions. We have a couple of guests today. Chief Batiste is joining us, and then Dr. John Stone is also rejoining us after having been here last week. First, I want to thank the City Council for passing the ordinance, which really allows the police department to write tickets for fining those that don't obey the curfew. That's exactly what Chief Batiste will talk about, how we will go about enforcing that. I would say that if you listen to the experts, this week and next week are the 2 most crucial, possibly the most crucial weeks that we have in the city of Mobile. So the order to stay home is very important, and we're taking it very serious. I know there are a lot of businesses that are exceptions to the rule, and there are a lot of employees that work at those businesses. But still, I would ask you, if at all possible, stay at home. Otherwise, you will be meeting the Mobile Police Department somewhere. I want to thank Brad Pitts and Synergy Laboratories, they are our link to testing. If you look at what's happened in the city of Mobile and you compare us to Birmingham, and somebody would say, how did Birmingham have tests before Mobile had tests? Why didn't we have them? Well, the reason Birmingham had them was they had a laboratory in Birmingham that was in the business of testing the PCR tests, the nasal swabs. We didn't have such a lab in Mobile. We have a laboratory in Synergy Labs, but their focus was in a different area. But as soon as the pandemic started becoming more apparent, Brad Pitts reached out realizing this was an opportunity for his company, but it was also a void in our community. So at that point, he ordered the equipment in order to be able to do the PCR test. He not only did that, he also ordered all the equipment he needed to make the test kits. And this was all in the hopes of, having Mobile prepared in a way that we were not, but also knowing that nobody else maybe would do that, and we would always be at the mercy of somebody else, another lab in another city, if we didn't do this. Not only did Synergy Labs do that, they also reached out and found out about the antibody kits, the little bitty blood test, which y'all are all familiar with. He ordered $75,000 worth that he paid for himself. He gave many to our first responders, Chief Barber, and to the hospitals. And at that time, I'm pretty sure there was no protocol. Nobody could tell us how to effectively use them as a screening tool or otherwise. They knew what it did. You could read the directions and say that if you prick your finger and you put the drop in there, it'll tell you whether you're positive. But how did you use that test? So we have come a long way in getting the position where we're now ramped up. But even if you go back to the beginning, our hospitals all had the ability in a limited capacity to do the PCR testing. And so it was minimal, but in the very in the most compelling cases, they could do that. I think it's important to set the record straight on that and to tell why we were where we were and how we got to where we are today. But thank goodness we are where we are. I'll let Director Barber in a moment talk about the testing that's going on at lab. I want to mention the face mask. So face mask, all of a sudden it's become apparent through things that you are reading or hearing about in the media. And it appears that the face mask, it does not protect me from anybody else. Let's visualize yourself in a grocery store. So if I walk in with a face mask, it's not to protect me, it's to protect the people that are working in the grocery store and those who are shopping in the grocery store. So it's a protection for others. We're starting to see a lot of people wanting to wear masks in the grocery stores. In the line outside of Sam's yesterday, as I was there about 8 o'clock yesterday morning, I bet you 90% of the people had on a face mask. Almost all of them were homemade. That's the key. So we're not ready to say exactly what the city is going to be. I talked to Dr. Isho for about 10 minutes about this issue just prior to coming down here. He and I both agree we need to be in sync in this, but the idea would be that if there is a cottage industry of people making these masks, then maybe that's the direction we need to go. But we do not need people who are shopping to be using the N95 mask and the surgical masks that are needed by our first responders. But we're not ready to make that recommendation yet, but we're willing to listen to what suggestions you may have. If you're in that cottage industry of making masks so that you can tell us how they can be distributed, we'll be glad to take that information and pass it along. Another question that's come up has to do with the homeless and what's happening with the homeless. Prior to the coronavirus pandemic, there were about 10 agencies in the city of Mobile that in varying capacities provided services for the homeless. All of those agencies have pretty much gone home for social distancing reasons, and the only one that I'm aware of is the Salvation Army. is still doing limited business because they cannot do everything that the 10 agencies were doing. So we are now researching what can the city do differently than what we've done in the past. It probably means that we will have to in-house find a way to set up portalettes, hand washing stations in order to deal with the homeless. I am aware of there's a food truck that every day goes around feeding the homeless, so there may be more than one. But other than those things that I'm aware that we can do, and that we're starting to research how we go about doing it, that's one of the casualties, I will say, of this pandemic, is that all those who were taking care of the homeless, they're now home. So very unfortunate situation, but we will continue to listen to ideas that come from the community and see what we can do to address that issue. So at this time, I'm going to call on Dr. John Stone, who's the Vice President of Medical Informatics, excuse me, the Providence Hospital. Dr. Stone.
That's right. Well, I think the main thing today is just to give you a little update on where we stand in the medical side of things. The hospitals, certainly at Providence, and just so you know, all the hospitals are communicating certainly on a daily basis so that we know where we stand, we know where the infirmary stands in Spring Hill. So there is that coordination going on. And we are keeping our volume of cases, surgical cases, still very low. I mean, only those things that simply can't wait another 6 weeks before something is done. And we have a low census. We've been able to maintain that. Of course, there's a flow of patients in and out. We've had several discharges that have been in the hospital with positive COVID diagnosis and have sent some of those people home. We've had a fairly stable number of patients in the hospital that have tested positive, and at any given time you may have 5 patients in the intensive care unit, but it's not going to be the same 5 that it is 2 days from now. So it's a moving number, but because we've kept our census low intentionally, which is kind of interesting that any business is kind of trying to put itself out of business to some degree during something like this, but that's kind of what's happening. But we continue to work at this. We have a command center set up, as I'm sure all the hospitals do, to try to ride herd on not only the patient situation, but the PPE and how much we have of that's available for use, not just for today, but extending out for the next few weeks. And that's very important, not only to the patients, but certainly to the staff. So we stay after that as best we can. And I think at this time, we're in reasonable shape. We can handle a surge. We have meetings about any surge that might have to happen as things ramp up, which obviously we don't know to what degree that's going to happen, but we're ready for it, and I'm sure all the other hospitals are too. So that's an update on our medical situation.
Thank you. At this time, Chief Batiste will come talk about the enforcement process for the curfew.
Thank you, Mayor. I'd just like to kind of talk about, we'd like to thank the mayor and thank the city council for providing us with an ordinance that gives us some additional teeth to enforce the stay-at-home order issued by the governor and the curfew that was issued by the mayor. We believe this ordinance will give us an opportunity to deal with those individuals that seek to violate the curfew and the stay-at-home order. It gives us a mechanism to either provide them with what we call a UNTCC, a Uniform Non-Traffic Citation Complaint, or we could still do the custodial arrest. Our goal is to get compliance with the curfew by just reminding people of the curfew being in effect and letting them know that there is a penalty for the violation. Again, it could be custodial or it could be non-custodial. The non-custodial will result in a UNTCC. First offense will be a $50 fine. First offense is $50 fine. Subsequent offense $100.
It's $100.
It's $100. Both. Okay. They changed. Okay. So first offense will be a $100 fine. Second, subsequent offense will be $200 fine. And again, the impact to the public. The most important thing is this: everybody knows that we need to be able to maintain social distancing. Everybody knows that the only way we get beyond where we need to get with this pandemic is to make sure that people are following the rules. And again, it gives us an opportunity to enforce those things that have been put in place by the mayor and by the governor to make sure that we make our community safe.
This time we'll hear from Director Barber.
Thank you, Mayor. The young lady to my left asked me to slow down, so I'm going to try to slow down my speech pattern so that she and Dale can keep up. All three sites that we're working in conjunction with the city, the two diagnostic medical sites at 1700 Spring Hill Avenue and Hillcrest site are up, as well as the Ladd Stadium site, which is now open to the public and is receiving the public. As far as our testing of first responders, the total tested as of when I took these numbers was 895. There was 38 total positive antibody testing, and that's that rapid serum test you hear us talk about, which is antibody test. Out of that, we have 4 total positive PCRs. So those are active viruses. Those individuals are quarantined at this point until we are sure that they are not spreading the virus. We are rating the results on 11 PCR tests right now. So all of the antibody tests, the 38 were given the PCR test, and of those we are still awaiting for 11 to return. To break that down a little bit further, 423 Mobile Fire Rescue Department were tested. 14 of them were positive for the antibody test. 1 was positive for the PCR test, which is the active virus. That individual was asymptomatic. Waiting on the results for 3 out of Mobile Fire Rescue. Mobile Police has tested 472. They have 24 positive antibody tests, 3 positive PCR tests, and we are waiting on 8 PCR tests to come back. That's it. Thank you.
Those numbers and rough figures would show that if you take the 4 that we had out of the 900 that were tested, that sample of 900 first responders could easily be a random sample in our community. And so to only have 4 out of the 900, is in the 0.3% range of those that have active corona cases, waiting on 12 other PCR tests to do, so that number may go up a little bit, but it looks like it's going to be less than 1% of the population in the city of Mobile, or the population of that group of people tested positive, which I think is pretty amazing, actually, based on what we predicted where it would be. So at this time, I'll be glad to answer any questions that anybody may have.
Has there been any thought for the first responders who have tested positive for the PCR to donate possibly? Would that help? I've heard that the antibodies may actually help with fighting for people who are seriously ill.
So the question is, has there been any thought given to those who have tested positive and who have recovered, from the COVID virus, to be able to donate their blood to be able to be used to protect other people? There could be that conversation. It would be going on at the hospital level. Dr. Stone may have something he would want to say about that, but I'm sure we know there's conversation about it nationwide. Whether we're doing anything here, I don't know.
There is a project going on now that I just read this morning, just came across this morning, where there are three options of participating in that sort of thing, because you have to, it's a blood donation sort of thing. So a third of the three options, one that would probably be most likely would be like an individual usage thing, so that you had somebody that was extremely sick and you just run out of things to do, that you might be able to do this. So it is being discussed. I'm not aware of anybody's being actually able to do that or having done it here yet, but it is being discussed.
So at this point, you guys aren't asking people who may have tested positive for it, who have now recovered, to
Not
come
yet.
forward to donate?
Not yet. Not yet.
Dr. Stone, for people who may be making masks at home, do you have any recommendation of what would be good for them to use for filters? We've seen a lot of questions about that on social media.
Talking about colors, nice colors, designs.
Of course, those as well.
Actually, just a solid cloth mask is fine. I mean, that's what people can make. You know, you hear things where people took some of these, if they could get a hold of some of the material that's comparable to what we use, like in surgical drapes in the operating room, and doing it from that. I mean, it might filter out. I mean, it filters out some things, but you know, the stuff that filters from the air is a whole different thing from like filtering liquids and what have you. So I don't know if there's anything that anybody could reasonably get a hold of to make. I think you're just better off doing a cloth
We did
mask.
one example that was given was vacuum bags. Is there anything to that? Do those actually help?
About what?
Vacuum bags?
Vacuum bag?
The bag
Yeah,
you put
like
in.
the bags for the inside of a vacuum. Do those help?
Oh.
Put those inside of masks?
I saw one brief thing about that, and it was not suggesting that as a thing to do.
I asked this to one of the hospitals who was here last week about if a minor, someone under the age of 18, would get sick with coronavirus. In New York, they are basically not letting parents be with them in the hospital. They're admitted. You guys have I know the policy is no visitors for these patients, but is it? I know one of the hospitals says case-by-case basis, where they'll try to figure something out so a parent can be with them if they need to be.
That's what we've done at Providence, is like one parent can be with them. Now, minor, you know, I mean, maybe not a teenager, but a younger child, then we've allowed, you know, one, but just one. You can't have like an entire family in there.
So while you guys have no visitor policy, there are some exceptions.
There are some exceptions. More of a
Clarification on the ordinance. So it's 100 for the first offense, 200 for the second offense. Does it go up in increments or does it stay
I haven't
at that?
addressed it from that point on.
Okay.
If you do it twice,
You hoping you'll stay home?
we'll address it. I just don't know what the answer is yet.
How many people have you guys, I know yesterday you guys said about 10 over the weekend, you guys responded to complaints about people who were gathering, congregating after. Do you have any updated numbers on what it was since the thing went into effect on Saturday, what it is now?
I don't have the updated numbers right now.
No, but there's, you know, really, no, we don't have any updated numbers on that.
What about hazard pay? Baldwin County and Mobile County Sheriff's Office have instituted hazard pay policies for officers. I know we talked last week a little bit about that, and you guys said maybe 48 hours out. We're 96 to 120 hours now.
Yeah.
Out from when you said that, where are we on the hazard pay?
So I have pretty much in hand all,
And Pritchard as well. So
Okay.
there.
Okay.
Richard.
So the question is, where are we on hazardous duty pay? So let me back up and tell you how it all evolved, and that is that the county agreed to pay time and a half to the Sheriff's Department. And they were the first place that we can find in the state of Alabama where they agreed to pay hazardous duty pay. There may be somebody else that had done it previously. We're unaware of it. If you think about the difference in the city and the county, is that the county's revenues, about 75% of them comes from ad valorem taxes. 25% would come from other taxes, which would include sales taxes and other fees. In the city of Mobile, 75% of our revenue comes from sales taxes. 25% comes from fees, ad valorem taxes, and others. So we're really at opposite ends of the spectrum of who's going to be the most detrimentally impacted by this virus. the city will take a much bigger hit on revenue than the county will. On, I think it was April 1st issue of Lanyap, Paul Wesch was quoted as saying we projected, it had to have been sometime prior to being published, that we thought we'd have about a $7 to $7.5 million monthly loss in revenue. Since it was printed, we now think that we will have a $12 million loss in revenue on a monthly basis. Our revenue is about $22 to $23 million. So we're talking about a 50% hit in revenue. If you have a $60 million fund to a disaster fund, rainy day fund, and you're going at it at $12 million a month, in 5 months, you'll have gone through your reserve. And then what? And talking to the 10 mayors, at the time I talked to them yesterday, there was only one who was thinking about it. That's probably changed, but at the time, because these are mayors of the cities that again will be impacted more so than the counties. And then there's another consideration for the city of Mobile. Unlike any other city except for Pritchard maybe, and those on the Eastern Shore, is if there's a hurricane, the way we get reimbursed for whether we pay for the hurricane is that we go into our reserve first, and then we hope to be reimbursed by FEMA. FEMA does not necessarily reimburse every expense that we have. We don't know if FEMA will reimburse for hazardous pay in this situation. It hasn't been tested. So looking at the situation where we know we're going to have declining revenue, we cannot predict how long that will go on. At this point in time, we have not made the decision of what to do about it. They've been in discussions, preliminary discussion with some of the city council. We're all aware that it needs to be discussed. We do not think that today is the time to pull the trigger on that. Another thing that to throw into that mix is that this is something that in the next bill coming out of Congress that may be addressed about hazardous duty pay. If it is, we'll make up our mind as soon as the president signs the bill, because we think we know what we need to do. There's another piece of our decision process that on an unsolicited basis, on the 2nd of April, I received a copy of a letter that Major Philip McCrary had written to all the police officers. It was not asked to be written by Director Barber, by Chief Batiste, or the mayor. And it explained in great detail about asking for hazardous duty pay. To me, it was a real sign of leadership on Major McCrary's part. And anybody that's considering giving, no matter what side of this issue that you're on, I suggest that you read his letter so that you understand what the impact is. So we are balancing all of that I've just mentioned, and probably something that I overlooked. We will be in conversation with the City Council. We've made further decisions on maybe how we should do this, should we choose to do it. So, Dale, the comment about 48 hours, and it's been 96 or whatever it's been, today we know what to do. Today we think we know how much to do. But today we're not ready to say this is what we're going to do, and until there's some direction and conversation with the City Council, we're not ready to stand and say we're going to pull this trigger yet.
Yesterday you said that the grocery stores are not falling into that 20%. Has there been any thought to change that? I know I just saw an alert from a different grocery store up in the Northeast that has decided to go to 20%, citing safety for their employees and customers.
So, Tyler, I think that a comment was made that maybe it looked like when we were at 40%, then we went to 20%, we were reversing course on the big boxes, but really if anything, going from 40 to 20 on the big boxes was accelerating. I mean, going in the same direction. Okay. Now, whether we'll do that with the grocery stores, we haven't had the discussion that we should go to 30 or to 20. We're open to it, and if we feel like that's what we should do based on what we observe, we'll certainly do it. I will say that the decision with the big boxes, part of that was created by their request to help us. We think that we need more done inside our stores. We don't mind doing that, but we're not quite there yet either on the grocery stores. Yep.
Mayor Simpson, you mentioned you were kind of talking about the rainy day fund, and you mentioned hurricane season. It isn't here yet. It is around the corner in June. But are there already discussions between the city and the Mobile County Health Department as to what would happen if we get a hurricane?
I think there's be more to come you'll hear about the collaboration that Dr. Asho and the president of the county commission, Jerry Carl, now they'll be standing up an incident command for us to move forward from this point in the COVID crisis. But it would also be thinking about where are we in the future based on what a hurricane may present to us. Yes, but the incident command that will be stood up will really be specifically for this. But I can tell you that already that there's better collaboration probably than there's ever been, even during a hurricane. The virus has created that we almost have to talk to at least almost every day. But we'll get better at that. Yep. That good? Yep.
One thing, I think we talked to you earlier about the technicality of the ordinance banning the wearing of masks in the city of Mobile.
Yes. Yeah, it was told to me today, earlier, by a friend in the media that it's against the law in the city of Mobile to wear a mask other than during Mardi Gras. I'm not surprised. I think there's a way to overcome that. I think that Dr. Asho and myself, we can get together and we can decide how you overcome that. But I think he has the ability to do that at the point in time. But again, when it comes to the mask, it's like a lot of these things that you're asked the question, why don't the mayor or Dr. Asho go ahead and make this decision? Well, every decision we make has some kind of ramification that others haven't maybe thought about. And on the mask, it comes down to we do not want to create a situation whereas vital PPE, N95 surgical masks, that we start finding people walking around grocery stores using them when we have nurses and doctors and others having to reuse them on several occasions. I will, before I close, actually, I've got one more thing I want to say, but I'll call on Director Barber because yesterday the comment was made, do we have a hot spot that we are aware of geographically in the city from coronavirus? So I'll let him touch on that.
We've actually provided some graphics on this. We actually went ahead and mapped the areas where we're responding to Signal 99 calls. And again, those are infectious disease calls for service. And so it's where somebody presents with some of the symptoms known to be corona or COVID-19 symptoms. And what I'm talking about is the fever, the cough, the shortness of breath. And so whenever we receive those, the response by Mobile Fire Rescue Department is full PPE, gown, mask, shield, along with gloves. And so we have seen an increase. We reported that increase to you before, but what we did was take it day by day to show you the trend lines within the city of Mobile. And we also mapped where those calls came from. This occurred probably beginning around the second week of March all the way to date. And so George Talbert will make those graphics available to you so that you can see exactly what your question will respond to. And so we'll see that trend line going up. You'll also see that it's scattered throughout the city of Mobile.
Are you guys done testing first responders?
We are down to very few. The question was, are we finished testing for first responders? Mobile PD and Mobile Fire Rescue are down to very few that are waiting on tests. But what you will see at Ladd Stadium today is the Mobile County Sheriff's Department beginning the process of putting their personnel, not just sheriff's deputies, but corrections officers, through that same type testing, antibody testing.
Can people leave to get food during the curfew?
No, during the curfew, it's a complete lockdown on the streets. And what you're going to see is officers checking to see for voluntary compliance that people are complying during that time. So we'd certainly suggest that during the non-curfew hours, which were after 5 a.m. until 10 p.m. that night, that you get your grocery shopping done.
So restaurants can be closed?
Oh, yes, sir. The restaurants will be closed.
If you're an essential employee, you should have a form, right, that lays out that
That's-
this is where you're going.
Yeah, the question being if you're an essential employee, so if you're a first responder, a dispatcher for 911, if you're medical personnel, utility worker, all of them mostly carry badges. Journalists carry badges identifying themselves, and so traveling to and from, they are exempt from the curfew, but you can expect possibly to be stopped by police, and make sure you have those credentials with you so that they can verify that you are exempted.
Do you guys think Mobile Police will be making a lot of stops if they see people? Because, I mean, you guys are taking this very seriously. Do you guys think that?
The question is Mobile Police going to take this seriously? We're going to take it very seriously. It is an ordinance. It is a violation of law. And so you will see enforcement happening beginning tonight.
But you guys will continue I didn't mean it like that. Obviously, you guys take it seriously. I meant though. But you guys, from the moment 10 o'clock hits, you guys will start pulling people over if you see people on the street, or you guys, I mean...
You know, it's balancing calls for service with the enforcement of the curfew. And so you will see periodic checks by police to stop motorists to find out if they are complying with the curfew, and if it's one of those that are exempted from the curfew, or do we have a bunch of teenagers just joyriding.
We know that not a lot of people get pulled over. There are a lot of good citizens in Mobile that don't get pulled over. What should they do if they get pulled over to be asked where they're going? Can you walk people through that? Because obviously it's going to be happening if they're out and about doing essential services.
Yeah, the question was, what do people do when they're stopped by police when you see those blue lights? Pull to the right, stop, and just stay in that vehicle and await for the instructions of the officer. He will approach you and give you whatever instructions or ask for whatever information that he may need from you to verify you're not in violation of the curfew. But very good question. If you're in a really dark area that you're uncomfortable with, turn your hazards on, proceed to a lit area, and we'll confirm that stop at that point.
Are police officers also being outfitted with similar PPE to firefighters for those calls, those Signal 99 calls, or will they be given anything when they're doing these enforcement calls at night?
The question was, are the police officers equipped with similar PPE as firefighters are during these Signal 99 calls? The answer to that is no. The police officers, if they're called to move over and assist and they know that they're responding to an infectious site, will use basic PPE, which is the N95 mask you hear so much about, and gloves. But the actual physical contact with the patient usually occurs between the paramedics and EMTs and not the police officers, which is why they have to gown up, put on the mask and shield. And you know, one of the other comments is in the cases that we can, they're putting the surgical mask on the patient, so that helps prevent the contamination not only of the firefighters but of our ambulances, as if we for some reason have to transport because of a lack of oxygen saturation in the blood. Yeah, I do want to comment that what we have seen on the enforcement side, Tyler, is incredible compliance by the City of Mobile. Very proud of the people in the City of Mobile. Very few people are resisting a lot of what we are asking them to do. But in those cases where they do resist, we do intend to motivate them. Thank you.
I'd like to reiterate one of the things that Director Barber said, and that's that if the blue lights come on behind you, and this will be after 10 o'clock at night, and it'll be before 5 o'clock in the morning, typically. As he said, turn on your flashers and go to a lighted area, because we don't want you just stopping, on the side of the road in a very dark area, especially if it's a 2-lane road, so you can slow down and proceed to the lighted area. Is that solid ground there? Anyway, just be very thoughtful that by turning on your flashes, you have alerted the policeman that you recognize he's behind you and that you're going to pull over when you think it's safe to do so. Okay. The last thing I'd like to say has to do with Easter Sunday. Tremendously grateful for what Governor Ivey did, allowing the drive-through church services or the parking lot church services. We've had one last Sunday, we talked about it, Lighted Up Mobile. I was called today about church, the pastor renting a bucket truck so that he can be up high in his parking lot. He has a rather large parking lot. I'm of the opinion that there may be, even though we will not be holding church service, and there will be a lot of little girls that don't have Easter shoes and nice Sunday Easter dresses, and we're not going to be maybe hiding and looking for Easter eggs. But there's nothing to keep us from praying. And I would be willing to say that I believe that this Easter there'll be more prayers being lifted up in our community maybe than there would be otherwise. You don't have to be pastor-led to pray, but I know all the pastors in the city of Mobile are grateful for what Governor Ivey did. So thank y'all very much.
All right, we were just listening to Mayor Sandy Stimpson and a couple of our leaders here in the city of Mobile. But before that, we did listen and hear from Dr. Rendy Murphy from the Mobile County Health Department. Now, she said we heard that the peak is expected to be near April 18th. Again, that is just something there to keep in mind, April 18th. And she did plead with healthcare workers. If you're healthy and well, she does want you to go to work if all possible. We do know that you are needed right now. Now, as you just heard, we heard from Mayor Sandy Stimpson that curfew ordinance did pass this afternoon with the city council. Now $100 for the first violation and $200 for the second violation. He and Director James Barber did say if you get pulled over maybe tonight or in the coming days, if you're in a dark spot, to go ahead and slow down, turn your hazards on and proceed to a lit area. They want you to be safe. Also, Director James Barber said that 895 first responders have been tested for COVID-19. 38 positive antibody test results came back. 4 positive PCR test results came back. All of those people are quarantined right now, and we are waiting on test results for 11 first responders with the PCR test. So again, something to keep in mind. You're going to want to stay tuned here to Fox 10 News at 4. That's coming up in just under 20 minutes. We're going to break down all these details for you. We'll see you soon.